In order to start with some interesting information so we can start our discussion, I have some statistics from the Class Central Report, which is a website for statistics to get regarding the online education and MOOCs. For the report of 2017, we have around 81 million online users. And for these users, there are a lot of platforms all over the world. And during the 2017, the increase of paying users is more than 70%, which means that the awareness of people getting for online education is getting bigger and bigger. The question is, what about the middle-income countries? How do they perceive the online educations and e-learning? And from the 81 million users and from more than 99 million courses and programs for the online education, only 7.2% are talking about medicines and health education. So I want to start with Atish. Can you watch the? I think they're having problems with the computer. Let me talk about Atish while they are preparing the presentations. Atish is a social technologist, entrepreneur, and he's the director of global innovation in the Humanitarian Leadership Academy based in London. His background in software engineering, artificial intelligence, computer interactions, and he has more than 18 years experience in leadership in roles in technologies and international non-profit organizations, including United Nations. Atish has constantly implemented successful education technologies and served thousands of different learners across the countries in difficult contexts. Atish is also the founder of Gamotica, a collaboration digital platform that enable organizations to create their own mixed reality learning games. He's a global citizen, having lived in 6 countries, and is a regular speaker in conferences and events on the role of technology enhancing learning.
Great. So, no, thank you very much for that introduction, and thank you very much for sticking around as well. I know we're the last session before lunch, so do bear with us for a little bit more. So I think, yeah, I already had an introduction done, but just to say in terms of the discussions we've been having in the last few days, I think in terms of my own career, as you heard, I think that interdisciplinary approach, sort of my background, having worked in the humanitarian space, I was in fact based in Beirut for the early days of the Syrian crisis, having worked in the tech sector, having worked in corporate learning and development. Seeing those different perspectives has really shaped my view as well on distance learning and how that can really work in our space. And on top of that, also, I've put in a few flags there. So I think we also need to work with different cultures and different contexts. So those are the 6 or 7 countries I've worked and lived in. So in terms of what, my talk, I'll shape it on 3 things. One, I'll talk very quickly on what the Humanitarian Leadership Academy does. So you heard from Saba yesterday. I work closely with her on what we do around making learning impactful, how do we not just disseminate learning, but how do we create learning which really has an impact, which really scales to achieve our ultimate purpose, which is to have more resilient communities to save lives. So that's sort of our bigger picture of what we're trying to do. But I think one thing that I'm becoming more and more sort of vocal about is, and this is not just with learning, it's with many other ways in which young people or other people are accessing technology. We need to start creating active creators, active engagers with technology rather than just passive consumers of learning and technology. So I think that's something we've started the journey on, and using innovation as a tool there to do that. But I think that's an area we need to do a lot more work on. So practically, in terms of what the Academy has been doing, we have, and we heard a bit about massive open online providers. So we've created something called Kaya Connect, which is, I would call it a bit of a Coursera or edX for the humanitarian space. There's a number of online programs, MOOCs, etc., which are tailored, targeted for the humanitarian community, whether you're professional or a volunteer. I would encourage all of you to go on and access it and share it through your networks. But I think just the technology in itself, the platform, doesn't serve its purpose without the great network of partners we have in Kenya and the Philippines, here in the region, in Bangladesh. So for us, this technology, again, the learning is shaped very much by existing academic partners, practitioners in the NGO space, Red Cross partners, and they are working with us to create and share learning. We are not experts in a number of thematic areas in the humanitarian sector, but we're very much working together with and through partners to populate this catalog. And I think the last piece, which I'm going to focus my talk on, is let's continue to push the boundaries of what we can do through platforms. I think it's very easy to settle into this mode of what e-learning is and what it can achieve, but why aren't we pushing the boundaries, especially in the context that we work in the humanitarian space, where you have challenges of access and digital literacy and bandwidth, but also engagement. I think when we're comparing, a lot of people compare e-learning between face-to-face training and e-learning, that you're comparing apples and oranges. Why are we not sort of talking about how we can increase more human-to-human interaction in an e-learning platform? And I mean, we are doing it a lot on social media. Why are we not doing it on learning as well? So going a bit into innovation, then when we talk about innovation, I make jokes a bit about innovation being the most used and abused word. But I think for us, there's this, how you're using innovation to create new value. And our focus around first demystifying what innovation is, what is product innovation, process innovation, what is incremental and disruptive innovation, and how can especially humanitarian organizations use it to do innovation in a better way within their organizations and in an ethical way as well. So around this first area, we have a couple of courses. Again, I encourage you to go and access them on Innovation Essentials. But also, we've been working with the Institute for the Futures in Palo Alto, California, and doing this mashup of a course between foresight methodology, if you haven't heard of it, is trying to look to the future, looking at signals, trends, disruptors, and trying to correlate those with humanitarian trends around natural disasters, protracted crises, etc. So these are two really interesting pieces we are working around. The first area around processes, methodologies, tools to make innovation happen. The second space is around the innovations in learning, and that's, I guess, what we'll be talking a lot about, is what are new, novel ways to look at education. And again, I'm quite opinionated about how education has not really changed since the Industrial Revolution, and a lot of us, I'm sure, will agree on that. And there are opportunities here. I don't think there's a magic bullet for this, but there's a lot of opportunities. So we've started to identify some global technology trends and looking at education applications for some of these. So very practical examples. So we've been using gamification as a way to make learning more engaging. I have a bit of a case study on that. We've just recently been using immersive virtual reality and augmented reality in a very low-cost way to create empathy, to have more crisis immersion. So imagine you're a volunteer going to work with a local Red Crescent society. How would you know what it feels like to really have been in the crisis, or how is it to be in a refugee camp? So how can we use low-cost VR to create empathy, to really immerse people into scenarios? And around artificial intelligence in education, we are looking at very simple uses of chatbots at this stage. And again, I'm not a techno-optimist or a pessimist. I think artificial intelligence can do a lot of weird and wonderful things. But I think right now, looking at the very basic, mundane administrative tasks around education, around following up with students, around giving simple feedback. So we're looking at a chatbot that can engage our 500,000 Facebook followers and bring more of them, start the learning processes on Facebook, unfortunately, where our learners are, and then bring them gradually into sort of more engaging learning pathways. So these are just a few of the 3 areas that we've started in. There are other areas around, other technology areas that we're also looking to bring in, and I'm happy to talk with you more on that in the break. But looking more broadly at future of learning trends, and this cuts across primary, tertiary, adult, corporate learning, that learning needs to and will change, whether we like it or not. And looking at the 4th industrial revolution with automation and artificial intelligence and the nature of work, this we cannot keep sending people back to 3-year degrees, 1-year diplomas, if they need new skills to do a different kind of a job. So I think we've already started, as you mentioned, there are a number of people already engaging with modularized, personalized learning, which can be accessed at scale. So learning which is really tailored to you, to your competencies, to your needs, to your gaps, and using concepts like nano-credentials, badges, edu-blocks or blockchain in the future to recognize skills in a way which gives it some value, so people don't only look at a 3-year degree or a diploma with some credibility, but they start to recognize these nano-credentials also in a different way. I mentioned some uses around augmented and virtual reality. Again, a lot is happening in this space. The costs are coming down. But I think from a training education perspective, again, we saw yesterday some incredible applications in the medical space around how doctors and surgeons are being trained. And again, as I said, on artificial intelligence and education, I think that a lot more is going to happen in the future. At the moment, just taking the burden off educators who are supporting larger number of students, making some of those processes simpler and easier for them. And then finally, around gamification, this is a very quick case study, and I'll close with this. So we've been looking at, especially in the humanitarian context, certain types of skills, responding to very complex scenarios, working on behavioral change. How do you do this type of learning with e-learning? And how do you combine knowledge transfer, which we do with, let's say, self-guided online learning, together with actual practical skills application, working in teams, and getting feedback? Because if we think about it, this is how we all learn. We don't learn by just reading a book or watching an online course. We need to practice these skills and get feedback, and do it wrong and get feedback again. And so from my UN days, when we were working on these types of simulation exercises where you get put into teams where, for the fun of it, they kidnap you for half a day, and they put you through this experience of that's the way you will know how to respond in that situation. So how can we take this kind of learning, which is very immersive, which is very role-based, scenario-based, and provide real-time feedback? And again, I can have a very long conversation about gamification and serious gaming, but really creating this sort of game-like experience for learning, but doing it in a low-cost way. We don't have Hollywood-style budgets to create these kinds of games. So we started to create, with the Open University of the Netherlands, this platform around how do you enable trainers in our space to create their own learning, allowing then the students, so these are some examples of role-based learning, and allowing the students then to play this with each other, combining technology and real-life interactions. And then we started to combine design thinking. So the point here is that you can't just take these different technologies and push them out to your different audiences. You have to think about, and for those of you who don't know, sort of design thinking is very much starting on the left side with who is your learner, who is your user in mind, starting with their functional needs, their non-functional needs, and working your way up to a learning journey and design elements, and then creating real learning products that meet their needs. But putting these tools in the hands of people who are really experts or who understand their topics, rather than us doing it on their behalf. So I think this is one slide that I hope I will leave you with, is when we think about innovation, is think about the first box, which I think is the most important. Think about ways we can create spaces where really interesting learning can be created. Think about how we can put the learner always at the center of everything. And then the second box, the technology, will then work with that well. Because without keeping the user at the center of what you're doing, you will not get effective learning. And then the third box is really about scale. How do you find mechanisms to take these really interesting innovations and take them out to scale? So finally, I wanted to share these images. I was here with my colleague Mohammed in Amman last month, where we were working with youth groups to use this methodology, to use this technology, to co-create learning around youth engagement with the Sustainability Development Goals. And they created some amazing and very inspiring learning from this workshop. And through these learning games now can be accessed by a larger number of people. So in closing, just a few takeaways. Do go on to Kaya, share it with as many people as you can. Reach out to me, collaborate with us on all of these, as I said, weird and wonderful things we're trying to do. I think the future of learning is modular, it's scalable, it can be gamified, and it will be continuous. Your education is not going to end here at this university, it's going to go on for the rest of your lives, unfortunately, or fortunately, the way you look at it. And finally, always remember to combine the technology with the user in mind as well. And there's a quote here around the future, that the future is already here, it just isn't evenly distributed. Thank you very much.
Thank you, Atish. This was very interesting. I have a lot of questions for you, and I know that the audience will have to. With our next speaker, Dr. Habib Faroui. Dr. Habib Faroui is the Associate Professor at the Public Health Foundation of India. It's a research-based academic organization. He's a physician, epidemiologist, with postdoctoral and early career training at the London School of Hygiene and Tropical Medicine. With more than 14 years of teaching and research experience, he's leading now the Faculty of Pharmaceutical and Economics and Infectious Disease Epidemiology at the Foundation. He also provides leadership role for the Center of eLearning at the Foundation. He also serves as a member of various national and international technical committees and expert groups. Dr. Habib.
Yeah, thank you very much. Thank you for a nice introduction, and thank you, Atish, for setting the tone for this presentation. As Shaban has already pointed out, I'm speaking from the perspective of an educational institution. So we have been in this area of e-learning for close to a decade now, and we immensely benefited with our collaboration with the London School of Hygiene and Tropical Medicine in setting up our e-learning portfolio. So we have been hearing about access to healthcare, access to technology, and in today's morning talks, we actually discussed about equity of those accesses, issues around that particular area. So I'm taking a framework-based approach in which, from our experience of nearly a decade providing technical education, both on on-campus programs as well as e-learning platform to Southeast Asia and also in India in a big way, we consider these 5 key areas as a key role of e-learning models in the future. So the heart of this particular framework actually talks about partnerships. And as I mentioned, that the partnerships are really, really important. As Atish also pointed out, about convergence of multiple disciplines in a core area to actually translate how learning between teachers and learners takes place. So there is a confluence of technology, but we also need learners and teachers in the same place. So there is a partnership at that level. But we also recognize that investment in e-technologies is a huge investment, and in that sense, it's actually really important to understand that the partnerships can bring strategic knowledge and technical skills together when multiple institutions come together. And there could be partnership at the level of the country level also. So in a sense, global North-South partnerships and global South-South partnerships. So with that particular background, I'll talk about all those related areas with at least a few thoughts that we have in our mind with reference to how we have delivered our e-learning education in Southeast Asia. But the core foundation of this particular development and delivery of the e-learning focuses on the equity of access. And with equity, I specifically mean equity, ensuring equity and social inclusion. And we know from our experience in India that there are special equity dimensions to access to education and access to healthcare also. In that reference, we actually put a focus on the center of focus on equity dimension in providing the technology and providing the education to the larger masses. And in that sense, we actually have to do a kind of a cross-subsidization with reference to the fee that we charge to our students. So for example, in India, the gross enrollment ratio, which is actually an indicator which tells about what is the kind of enrollment across in a specific class size, what is the enrollment with reference to the participation between males and the females, and the participation between socially disadvantaged groups and socially advantaged groups. And we see that there is a huge anomaly in that area. And I think e-learning platforms are one of the core technologies which can actually bridge this gap, especially from the perspective of technology being a disruptor and readily available to the masses through now the mobile platforms. The second area that I consider is important for e-learning platforms in a sense of a great game changer would be like controlling the cost of education, both from the perspective of the educational institutes who are offering education as well as the level of the learners. Because in a sense that at the educational institutions, we already have a huge resource in terms of the faculty and the human resources which are already there. But what is sometimes lacking is the technology platform which can make use of this particular resource already available and can transcend the boundaries of the campus and can take it to the level of the country and also to the global level. And we have seen this experience with the uptake in the massive online courses. And in that sense, the government of India also actually come up with an idea of setting up a national platform, which they call a SWAYAM platform, to host these courses provided by the various national universities, both in the public and the private sector. And this platform, if you put your courses, they are available free of cost across free of cost to all the citizens in the country. So in that sense, technology is working as a great leveler. With reference to the quality control, I recognize technology, especially the virtual classroom settings in the e-learning as an important, I would say, innovation. In that sense, because it brings together various teaching and learning skills and various kind of individuals together in a classroom, as Atish pointed about game learning and various use of other immersive technologies like augmented reality and the virtual reality. So in a sense that because this particular level of technology that we now have access to, it provides a kind of assurance to the learners that they can learn at their own paces, which helps in a big way in actually ensuring and enhancing the quality of the education. With reference to access, we know that this access to technology is a function of the access to broadband, access to other technology commodities, and it is different in different countries. It could be very high in India, but it could be very low in the neighboring countries. So in that sense, that it is really an important imperative of the educational institutions, actually not only to bring access to the technology, but also to provide access to technology to those learners who don't have currently the access. So in that sense, like at PHFI, what we do is we try to help state governments and various other partner agencies to get technology through some of the partnerships which we have with the philanthropic organizations. We train human resources in the health to use the technology, and then we also help them to use that technology to perform their health system related duties. So in a sense, I think that's a far wider role that we need to play, not only in providing access to education, but also in providing access to technology. And I think, again, I'll go back to the specific indicator that I talked about. For example, in India, we have the gross enrollment ratios in higher education at a very low level. It's like ranging between 25 to 26%. But if I look at the gross enrollment ratio in the primary and the secondary education, it is like as high as 100%. So where is this particular knowledge gap, and what is the gap? What are the reasons behind it? And we realize that it has something to do with the legal system also. In India, we have what is called as the right to education, under which up to 14 years of education, 14 years of age, you have to provide free education. But after that, it's like a subscription business. You get education only if you have money to pay. So I think in that particular area, e-learning models and e-learning platforms has a great role to play. And they can bridge this gap by providing higher enrollment rates and actually making a quantum jump from on-campus programs directly to e-learning programs. And I'll come back to the issue about the regulation in my last slide, but suffice to say that they play a major role in actually creating a conducive policy environment for e-learning. And as Atish has rightly pointed about the lifelong learning phenomena, and we know that the technology has we are on the brink of the next revolution, and the economies in the countries are moving in a different direction. And some of the tasks which are really repeatable, we don't really need human beings to do those tasks, and they are probably more shifting towards artificial intelligence, deep learning, and also towards robotics. So in that sense, there would be a huge chunk of human resources that probably will not be relevant in next few years, and that's where the role of e-learning models become even more important, because they are the ones which can provide you both technology and the platform to keep you employable for the lifetime, in a sense that they would give you a platform to learn these techniques and remain employable for the lifetime. Then taking the cue from employment, this real-life learning also helps people now become more innovative. And from the innovation perspective, then opens up an entire area of new entrepreneurship. And I think e-learning platforms, contrary to the on-campus programs, are a better way of developing entrepreneurship skills in the individuals, because it's by design it relies on partnerships, and you can create these kind of partnerships easily on an e-learning platform as compared to the on-campus programs. So I did talk about partnerships to a great extent, so I'll skip this slide. But in final thoughts, we, from our experience in engaging with various stakeholders, not only just the teachers and learners, but also with the policymakers and other stakeholders like NGOs and other multilateral, bilateral organizations, we realized that a conducive policy environment, which is usually created as a outcome of a legal act that governs a specific area of enterprise like education, they play a key role in actually making an e-learning area successful or unsuccessful, depending upon how the policies are designed. And as Atish actually pointed out about the innovation within the e-learning and within the technologies, and in morning talks, some of our colleagues actually expressed about the lag between the legal and the regulatory framework and the innovation that is happening in the technology, that I also realized, and we at our institution also find that that's a challenge actually, to regulate the technology and at the same time promote the technology with respect to the innovations that they can bring in. So in that sense, it's really an uphill task for the national governments to actually keep a framework of a regulatory system in place, which actually helps institutions to develop academic credentials by using e-learning, but at the same time does not hamper the technology providers and the platform providers withholding their innovative capabilities. So with those two thoughts, I come to my final concluding thought, and which we see as a major impediment in actually enhancing the access and enhancing the credentials of the e-learning, is about this perception among the employers, and also sometimes perception at the level of the, I would say, policy makers, about not considering e-learning courses at par with the on-campus courses. And I think it's really important for national governments to move forward and consider and create such a regulatory framework and policy environment which actually brings both on-learning courses at par with the on-campus courses, which definitely will help benefit both the institutions who are providing these programs as well as the learners who want to indulge into them. Thank you very much.
Thank you, Habib. Thank you very much. Our next speaker is Dr. Badr from AUB. Dr. Badr received his MD from AUB in 1980, and then after his residency, he completed his 4-year fellowship in nephrology at the Brigham and Women and Children's Hospitals in Harvard Medical School. He joined the faculty. He served as a faculty member, as an assistant, associate, and professor in Vanderbilt University, and then Emory University. And he also served as the nephrology section chief at the Atlanta Hospital and the director of Center of glomerulonephritis 1992 to 2000. He chaired the Department of Internal Medicine at the American University of Beirut from July 2000 to December 2006. And then he was named as the founding dean of the new medical school at the Lebanese American University. In 2010, he came back to AUB as a professor of medicine, associate dean of medical education, and the director of the vascular medicine program. He was elected as the American Society for Clinical Investigation in 1991, the Association of American Physicians in 2001, and the Lebanese Academy of Science in 2009. Dr. Badr received his NIH and other grant support from 1986 to 2000. His main interests are in renal, microcirculatory psychology, the biology of inflammation, hypertension, and vascular diseases. Dr. Badr?
Thank you. Thank you. Ziad, this was unnecessarily long. So I'm here really to talk about my role in education, and particularly in the involvement of e-learning in healthcare. And chose to title my talk e-learning for e-healthcare, the inevitable disruption. Because e-learning is no longer a luxury or a choice. It is an imperative, because the profession of medicine and of all of healthcare is changing in such a dramatic fashion towards the use of e-devices, the e-methodologies, etc., that e-learning has become an essential part of the training of healthcare workers. And the current dogma, at least from the studies that have been done, show that direct correlation exists, obviously, between the availability of health workers and the health services, between the amount of healthcare workers, according to the WHO, for example, reports that the world will need 7.2 more healthcare workers in the future to ensure the adequate global health is delivered, and that there's a big shortfall in this. And to make up for that, there is a push for the use of new technologies. But I would like to to challenge this, actually, by saying that I don't know whether we really are going to need so many health workers. And you may ask, why is that the case? The health burden in the world is increasing. So what I'm going to do is to take you to a scenario that would be in the year, let's say 7 years from now, the year 2025, to show you how healthcare will be delivered at that point in a very simple situation. And none of what I'm going to show you is fiction or imaginary. All of that is already existing in terms of technology, some of it already FDA approved, but it is a demonstration, a simple demonstration of how different healthcare delivery will be. So let's imagine ourselves 7 years from now, and this lady has developed a urinary tract infection or burning on urination. Normally, under these circumstances, she would go to her doctor, he would examine her, order a culture, send the culture to the lab. They'll wait a few days. They may start her on antibiotic. It may turn out to be the wrong antibiotic. They have to change the antibiotic later. Dr. Bizri is with us here. But at that time, what she will be doing, and she may not necessarily have to be a white woman in suburban USA. She could be a refugee in a Palestinian camp in Shatila. And I'll show you why in a minute. Because at that time, there will be available something called the Sherlock kit. And this Sherlock kit will be a piece of paper that you can buy from anywhere. And she will place a drop of her urine on that piece of paper. Now, this Sherlock, what it does, it's a very high sensitivity enzymatic reporter. So this is a system that can be designed and used even as a paper-based test. This does not require refrigeration. And it can detect, with a high sensitivity detector, a single molecule of a target RNA or DNA. So you can imagine, and this is something that's already been developed at MIT and other companies, that you can detect the presence of a virus or bacteria, discriminate various types, detect the antibiotic resistance from looking at the genes of the bacteria, identify cancer cells, and so forth. So by simply placing a drop of urine on that piece of paper, she will use her phone then to capture the information and transmit it to what is called a virtual clinic, which is a place where her data is processed. From that analysis, the bacteria is identified genetically, antibiotic resistance is determined accordingly, and the appropriate medication and prescribing instructions are generated and checked against her entire medical history and genetic background in a way that would be much more thorough and precise than any physician can do, because her medical record will be in the cloud, thanks to the developing blockchain technology that's going to make that secure and available. The needed pills then are generated in a very precise dose for her specifically, and they are manufactured and packaged in an AI 3D printed power virtual pharmacy, and virtual pharmacies are now do exist, and the FDA has already approved the first 3D printed tablet. So these will be very specified to what this person needs, her body, her size, etc. And then the pharmacy will automatically place this in a drone. And this drone, this pharmacy drone, which already exists, will fly the medication to her house. If her window is open, it will go into her living room. And within a very short period of time, this woman will be very happy because she will be treated for her infection. The total cost will be approximately $20, and it will take about 30 minutes for this procedure to take place. Now, what is missing from this whole scenario are all the health workers, right? The doctor is not there, the nurse is not there, the pharmacist is not there, and fortunately the insurance companies are not there either. So we really have a new system of healthcare delivery, and you may wonder where is the place of e-learning in all of that, since a lot of these healthcare workers may not even be involved in the system. So the question that we posed is, will we really need all these millions of healthcare workers? Becomes even more relevant as technology takes over more and more of the diagnostic, therapeutic side of medicine. And the intellectual construct really of why we need e-learning for e-healthcare comes from the fact that in the future, in addition to all these dazzling technologies, particularly for short-term diseases, there is going to be a much greater need for the personalization of care. And this personalization of care will require that physicians and healthcare workers acquire new knowledge in the areas of skill, in two main domains. One of them is technology and artificial intelligence, because it's obvious that the whole healthcare edifice is going to be transformed by technology and AI. And one needs to know that in order to answer competently three important questions that relate to patients' diseases, which are much more usually complicated than a simple urinary tract infection. And if we take the case of cancer, for example, or heart disease, which are chronic diseases that require continuous interaction between patient and doctor, one of the first things that the doctor is going to need to know, or the healthcare worker, is how is the patient's body unique to deliver, as we saw, to deliver the precise form of medication and treatment for that genetic and epigenetic makeup of the patient. The second is to characterize the genetic makeup of the disease itself, and particularly in the form of cancer, there are now specific designations for each cancer in terms of its characteristics, its malignancy, etc., so that there is a specificity of the disease in addition to the specificity of the patient. And then finally, there is a very complex specificity for the treatment that takes into consideration both the disease and the patient in generating exactly the kind of pill or injection or operation or treatment or whatever that is needed for that patient. So this individualization of care requires a major knowledge and skills in the area of AI and technology. The other unique aspect of the person of treatment is going to be not just to know the uniqueness of the patient's body and the disease and the treatment, but also of the patient's story and how that treatment is going to be delivered over time in a relationship that creates healing and not just prescription. And that is the whole field of what we call narrative medicine that was beyond the scope of today's discussion. So a few weeks ago, we had a meeting here at AUB in association with the American Association of Association of Academic Health Centers, other universities in Lebanon, and Columbia University's Narrative Medicine program, in which we addressed this dialectic of humanism, technology, and how they're going to interact in the physicians of tomorrow. And I want to just bring out from that meeting the recommendations that a group of students put together. Some of them are here. And in terms of how we should change our medical education program to fit the future. And in addition to what they recommended in terms of medical humanities and the need to include medical humanities both in the curriculum and the criteria for acceptance and in the medical curriculum and the pre-medical curriculum itself, there were also the students demanded that we make much more emphasis on applicants from non-biology backgrounds, that we engage and emphasize tech literacy, computer coding, digital sciences in undergraduate coursework encouraging non-traditional majors, integrating into the core pre-med courses, creating interactive, artificially intelligent virtual patients complete with personalities and credible clinical circumstances, et cetera, in terms of what the students wanted. And also, in addition to this heavy emphasis on including technology and robotics and so forth in the education of students, they also insisted on providing all social classes equal access to intelligent systems from the beginning of their training. And of course, there were many, many international speakers at this meeting, and the final recommendations of the meeting, just to give you an idea of how radical the changes that are coming in terms of e-learning are, is that we do need to create, and these were raised to the AHC meeting in Chicago a few weeks ago, a completely new medical education system or model which will graduate physicians who are committed to a symbiotic synthesis of humanism, artificial intelligence, and technology, and that will hopefully restore the direct, intimate doctor-patient relationship and provide a wider access to healthcare, as hopefully will happen in low middle-income countries. And that would actually require a revision of the structure of medical training, the pre-medical curriculum, and the medical curriculum, and integrating medical education into holistic cross-sectional healthcare training from the very outset. But is e-learning actually effective in health? Does it really work? Is it safe to teach people how to treat and do medicine and nursing and so forth simply remotely, or mostly remotely? And just to end on this piece of evidence, there has been a very good review of the systematic review of the effectiveness of online teaching by this article that came out in 2014, which reviewed articles that came out from January 2000 to 2013 on students' knowledge, skills, satisfaction, and attitudes towards e-learning and its cost effectiveness and its adverse effects. So they analyzed a lot of studies, ended up with 59 articles. Most of them, as shown by the green, were from the high-income countries, but there were quite a few there were some from low-income countries. Most of them obviously were from the US, but here they are as distributed over the various regions of the WHO. The risk of bias was present in some of them, as shown in red, but overall it wasn't terrible. I'm not going to go through all of the results, except to show that the overall result was that significantly higher gains in online e-learning interventions were found compared to traditional learning, and at least some of those universities, some of those institutions, whereas 27 studies did not detect a difference. 6 studies detected significantly higher gains in the intervention group. 3 found no difference between them. 12 studies tested students' attitudes, of which 8 showed no difference in attitudes. And student satisfaction, 4 studies showed higher satisfaction, and some showed no difference. The risk of bias, I think, was high for some of them. But in conclusion, from this very extensive review, it's obvious that current evidence suggests that online learning is actually equivalent, possibly superior to traditional learnings, and should be encouraged in future models of learning. Now, the advantages, of course, provided there is no harm, and these studies suggest there is no harm, is that e-learning provides all those things that have been discussed by previous speakers: access, adaptability. They can be used for much better assessment and analytics of learning. They are much more adaptable. They are catered to a global workforce, as mentioned previously, where they can be adapted to several communities. They provide a risk-free learning environment, particularly simulation and so forth. They can provide accelerated training in health needs for unexpected needs. For example, if there's a virus outbreak somewhere and you suddenly need to scale up the production of specific drugs or handle an epidemic, then the e-learning could be a quick way of training a subgroup of people in that and addressing demographic changes. So in summary, I think the future of e-learning in healthcare is very bright. There will be more formats, game-based learning, as we just heard, more interactive technology, and simulation will be very heavily involved in the future. And like other forms of technology, the cost of e-learning in healthcare professional education will fall rapidly, just as all the other technologies did, and it will become a major disruptor of the way we do medicine and the way we learn medicine. Thank you.
Thank you, Dr. Badr. Now with our last speaker, Mr. Graham Hathaway. Mr. Graham is the head of technology enhanced learning at the London School of Hygiene and Tropical Medicine. With around 20 years of education experience, he's holding several strategic positions for driving improvement in learning, teaching, and innovation. His passion comes from a core enjoyment and desire to teach. Currently, his work with academic staff includes the adoption of evidence-based learning, design methodology, and use of technology, aligns to a constructive mode of learning. Graham also teaches on the postgraduate certificate in learning and teaching and leads on the development of both students and staff digital capabilities. Graham.
Thank you. I'm conscious this is the last presentation before lunch, so I won't take much of your time. Just to give you a bit of an introduction to the institution, if you don't know the London School, it is based in the UK and it has 3 faculties, one in epidemiology, one in public health, and one in infectious and tropical diseases. So what I wanted to do today is I wanted to take you through a few innovations related to technology that I think are worth talking about in context of the lower or middle income settings that we're talking about. So the first thing that I wanted to mention is that we do have quite an extensive and growing portfolio of massive open online courses. We have a business relationship with a provider for their platform. We have 10 courses at the moment that are linked to those particular areas of faculty within the institution. And we have 3 other courses in production at the moment. So some of the noted courses that you might be aware of from the London School are things like the Ebola course, Zika course, and recently we had a health and humanitarian course. At the moment, local figures suggest that we extend participation of that information to over 60,000 people worldwide through that particular innovation. So we'll be coming on to that a little bit more in a bit. So we also have distance learning courses. So we run distance learning modules whereby we cover about 4,000 students every academic year. Technologically, we use a VLE or learning management system, and we make extensive use of webinars. We also have our face-to-face on-campus courses. We don't have as many of those because we're quite a small institution, but we have around 500 students who visit London every year. And again, they utilize the VLE, they utilize lecture capture, audience participation tools, and real-time collaboration tools. We also do a lot of work based on things like offline or low bandwidth modalities. So we try to tap into different technologies to try and use those appropriately within our provision. And lastly, really, we spend quite a lot of time looking at universal accessible design and also making sure that our courses and our resources are mobile friendly. Ultimately, it comes down to a discussion around pedagogy versus end-user requirements. And that's something that I'll probably spend a little bit of time now discussing. So this idea of just-in-time guidance versus a really deep learning experience. So just looking at the list of innovations there, bearing in mind the context of this particular presentation, which is looking at e-learning or technology-enhanced innovations within lower or middle income areas. The distance learning and face-to-face courses provision is not suitable because it obviously has connotations of being quite a costly service. So I wanted to talk a little bit about our massive open online course provision. Now, one of the things that we've done at the London School is we've tried to really tap into evidence-based or at least evidence-supported ways of working. Initially, when we started to create our MOOC portfolio, it was a really good way for our academic colleagues to extend the reach of their research and also to achieve development goals. In terms of planning, in terms of learning design for those programs, if you look back at our early courses, very much content and facilitation model. So the academic teams would create the content, maybe high-end videos or articles, followed by a discussion forum. So it was very much based on a content and facilitation model. We've worked hard over the last 18 months to try and innovate that approach a little bit more based on current thinking around constructivist way of learning and so on. So what we have now is we have more of a, I suppose, constructive way of thinking about how we do our innovation at LSHGM in terms of our MOOC portfolio. This came about probably from the Health and Humanitarian MOOC that had about 15,000 active learners on it at any one time. It was actually during the time when there was an issue of that going on in the world. So in terms of timing, that raised the numbers. But what happened was the actual participants within the MOOC from all around the globe actually engaged with the dialogue rather than the content. So it made us think around the sustainability of our e-learning resources. So the concept now is not necessarily just around content and facilitation, but it's more about trying to achieve that bit in the middle, which is the amalgamation of both content and dialogue. And what we find now within these courses that are on to their 7th and 8th run, where the academic teams have moved on to their next projects, is that they have become self-sufficient. So numbers have dropped as you would expect, but in terms of facilitation, they don't require the academic facilitation of that discussion anymore. The communities of practice from the people who are joining these courses tend to then self-perpetuate the discussion, which I think is a really, really interesting model. If you consider where these courses were previously, where it was content and facilitation, and it's now moving more towards this self-sustaining dialogue model, I think that's a really interesting thing that's worth considering when we're talking about e-learning being scalable and sustainable in these particular areas. Obviously, this creates tension and challenge, and it would be wrong of me not to highlight this. So, part of my role at the London School, I get to question the status quo, which is pretty cool, but it does lead to some tensions sometimes, as you can imagine. So I often ask around this end user question. So again, rewinding back to when we first started to create the MOOCs, it was all about our academic colleagues getting their academic research out to the wider globe, which was great. But now we're starting to look at those questions have changed. We need to start looking at whether these things are sustainable and whether they're actually innovating the people that we need it to innovate. So a good example of that is with our eye care MOOCs. So our eye care MOOCs, of which there are about 4 now, they have really good traction in these low and middle income settings. And these are primarily for healthcare professionals within those particular fields. So I get to ask these particular questions to my academic colleagues quite frequently, especially when we have an expression of interest to do another massive open online course. But it's always important to keep refreshing that in your mind around what do you want to achieve by doing these innovations, and do we have enough support? And when I talk about support, it's not just technical support, it's institutional support as well. So that comes down to the vision of the institution around why we're using e-learning. There is obviously the infrastructure, both for the institution but also for the end user, that needs to be thought of, and also financial resource. And I wanted to finish with, we talked a little bit yesterday in some of the workshops around this whole idea of innovation not necessarily needing to be technology, but technology being a driver for it. If we think about MOOCs have been around for a long time now. But recently they've started to innovate and change the way they're thinking in terms of how you do these things. So a recent study showed that they were able to do a flipped classroom model of MOOC, whereby the MOOC provided the underpinning theory, and then students or participants got together to discuss the content. And again, it's that sweet spot of trying to get that dialogue rather than just the underpinning content. And then finally, this whole idea about problem-based peer-to-peer learning, again using MOOCs as the platform. So actually setting real-world problems for the participants of MOOCs to actually come together either with peers or with a group to actually try and solve. And I think these are 2 really interesting ways of maybe considering how the MOOC program has flipped or maybe moved on from not just necessarily replacing academic courses? Thank you.
Thank you, Graham. If you want to have a common question for all of you, if we want to talk about the feasibility of the middle-income countries of adopting the new e-learning and the new technologies that Dr. Badr was talking about. So when we talk about the feasibility, we have to talk about the infrastructure. Will these countries will be able to adopt the new technology and to adapt the new technology? And based on your experience, what is the market size for middle-income countries that are using your technology? And if you have some kind of numbers or some kind of indicators about how the market is reacting to the new technology. And in terms of the content, most of you, where we are talking, you refer to humanitarian content, you refer to technology content, you refer to big data and artificial intelligence. And when you talk about big data, we know the core of big data in order to have an acceptable research or acceptable analysis from it, you need a valid source of data. Where are these sources of data coming from the middle-income countries? Is there any kind, it's all based on WHO data, or is there any resources that you can think of that you can pull up these data from? So we can start by
Sure. I can talk a bit about the access issue, because obviously sort of for the humanitarian sector, in a number of contexts we work in, that is a big issue. Having said that, so I realized, speaking to a group of academics, I did not have enough data up there. But the Kaya platform is now accessed by close to 100,000 individuals. It's a fairly new platform over the last 2 years. But the top 10 countries are Kenya, Philippines, Syria is number 3 there. So, and you've got the UK and US in the top 10 because of the number of NGOs there. But you've got Jordan, you've got Lebanon, Iraq. So I think it is encouraging. Having said that, I think there are clearly issues, and I think issues not just of bandwidth and of connectivity, but I think also of digital literacy, etc. So it depends to some extent on your audience, and for us, we are targeting both professional aid workers, where their access may be easier due to organizational context, as opposed to volunteers who may be much more grassroots, and there you have to be realistic about how far the e-learning goes, and we draw sort of circles where you've got one circle where your e-learning can reach up to, let's say, community volunteers, and then equip them with offline tools, guides, PDFs that they can download and take to people to what I call the last mile learning. And that can happen in non-digital way. So there are ways to work around this, but maybe I'll leave the content question to my other colleagues.
Well, thank you for your... Well, there are 2 specific questions that you mentioned about. One is the size of the market with reference to the technology used, and the second one is about the sources of the big data. So in a sense that we are not a technology solution provider, we are more of an academic and research institution. Our experience has been that the available technology with reference to the use of e-learning is not really, there are not many technology solution providers in terms of learning management system. 2 of which I know about are Blackboard, which is a proprietary software, and the other one is Moodle, which is an open source software. And then you have to actually customize them according to your requirements, the kind of the virtual classroom you want to create. And then you might need some other supports like VisIQ for real-time video transfer and audio transfer. Then there are many other technologies. So in a sense, these open source technology solutions are very competitive, and given if you have a technology wing in your institution, they can negotiate and customize these technology solutions to a great extent for the use of the academic and the research environment. So that's what our experience has been. With reference to the big data and the sources of big data, a lot of governments have now moved to open data repositories, and I think they are the one recognized sources of the open data that readily exist in all the lower and the middle income countries. And I think use of those data to answer relevant policy questions or relevant academic questions is also more acceptable to the governments when you go back to them with reference to some policy advice, because that is their own data. So that's our experience has been. I think a colleague from London School has more to say on this.
I don't think I do, but so I can really only speak from our perspective in terms of, I suppose, the key thing for us was finding a partner that we could work with to provide us with those services, including the capture of data. So we work very closely with our commercial partner to provide that platform, but also to provide the wraparound for the student. So they're obviously a commercial partner, so they have an invested interest in our courses doing well for their reasons, and then we have our interest for our courses to do well for our reasons, and sometimes that can be uncomfortable. But I think if you find a commercial partner to work with, where you can come to some sort of middle ground, I think you can generate the content that you want to, you can target the people that you want to from your perspective, and you can generate the data that you need to make assertions in whatever direction you need. So I can only really speak from our perspective on that.
Thank you. Yeah. Well, I'll just address briefly the question of infrastructure and resources in terms of the middle. I think the example of the cell phone technology or the personal is a very telling story. There are many areas in the world where there's no electricity, there's no water, but everybody has a cell phone. And Lebanon is also one example of a country where the infrastructure, as you know, is not ideal. But yet I think the technologies will become available as they become cheaper. And I think there is no doubt from all the predictions being made by the experts in the fields that in the next 10, 20, 30 years, these technologies will become as routinely used as cell phones are today. Of course, the speed of the internet and stuff of that kind is going to be important, but that too, I think, is spreading faster than people had expected.
Thank you, Dr. Otter. Is there anyone has a question? I think we have room for 3 to 4 questions, or 3 to 4 questions.
Hi, thank you. I wanted to know, do you think that the non-acceptance or the difference in the acceptance of the online courses compared to like courses taken in a university has to do with regulatory issues or bodies, the presence or absence of that? And does a patient demand or patient responsibility model work in community-based cultures where seeing a physician is an interaction and, yeah, not just like meeting a need?
Thank you for your question. I can speak a little bit about the efficacy of the online. So the best example I can give is our eye care courses. So we know that a master's in that particular area or a professional qualification may not be seen as the same as completing, say, a massive open online course. So the eye care team at the London School, what they're doing is they're looking at not necessarily accrediting their MOOCs, but looking at endorsing them. So if we chain several courses together, several smaller MOOCs together, to create an end award, but that award is endorsed by both the school and, say, an awarding body for eye care that's noted throughout the world. They're firmly in belief that will support the low and middle income areas in terms of their professional development. And obviously, those being the experts in their field, we expect that to happen. So I guess in that instance, that's how we're trying to support those particular areas rather than through the academic context.
Yeah, so I think in terms of, I touched briefly on the future of credentialing and recognition. So, and I think it's a little bit different for formal education and non-formal education, although I see eventually that line getting very blurry between formal and non-formal. But I think what is it that incentivizes people to seek that additional signature track or extra badge upon completion of a course online, or go rather to university? And I think the models I see at the moment, which are working quite interestingly well, are Udacity, for example. They work quite a bit in the tech sector. And what they're trying to do is they're trying to create courses which are based on the needs of currently what employers are looking for. And they actually work with employers to design and run those courses themselves. And so trying to link between employability of the learning intervention to what the market needs, I think is going to create a different model of trust around the credentials. And I think around technologies, obviously, we're looking at open badges, but blockchain, et cetera, can add that extra layer of verifiability and distribution where no central providers need to be custodians of credentials in the future. I think we are a few years away from it, but you're starting to see examples, as I mentioned, like Udacity.
Yeah, so if I can add our experience from India. So in India, there is this national or central regulator for education. And that regulator actually regulates all the education. I mean, it depends upon which regulator we talk about. It could be medical education regulator, nursing education regulator, business education regulator. And in a big way, the national government has actually decided to bring both online education and the on-campus education at par by bringing a huge educational reform, wherein actually they have established a specific eligibility criteria for the institutions. If they qualify for those eligibility criteria, the degrees and the diplomas and the certificates granted by those institutions would be at par for both kind of classroom and online teaching. So in a sense, there are different ways this system works. That could be perfectly okay for people who want to get into government jobs, but there are, as Atish rightly pointed out, about different I would say, innovation in the sense of what private providers are looking for. The private providers actually are more looking for skill-oriented courses, which brings in this specific issue about employability of the individual. So in that sense, maybe the standard government model may not work, but what would work is a new innovative model.
Any other question?
Thank you to all the speakers. My question is addressed to Dr. Badr. Doctor, on top of the financial aspect, what do you think may be major challenges when it comes to the implementation of or the inclusion of artificial intelligence and technology into medical school curricula in Lebanon?
The technology is, in terms of using it for teaching, is not prohibitively expensive as far as I can see, and I think that it's going to have to be part of a general worldwide change in teaching medicine, but particularly the skills that are required to handle big data, to handle digital science, and that is going to need a change in the curricula, and that is going to be more important than the cost. And this change in the curricula has to occur on a global level, not just in Lebanon, because it involves setting up new standards for things like examinations and milestones in education. So I don't see any specific obstacles in Lebanon to that, as long as it conforms with what's happening globally.
One more question here. Thank you. Yes, thank you. And my question is really two questions. I hope I have a quick and brief answer. First, most of the e-learning now has been concentrated on what you call complementing current basic learning or a postgraduate training or somebody who is already qualified. Would our panel, who are quite experienced and distinguished, believe that e-learning sometimes can replace, at least at a certain level, the current classical learning? And the second question, is there any moral obligation from a university or any teaching institute when they introduce e-learning courses to make these courses credible to the legislation bodies, especially in the area or the community where they are really existing.
Thank you for your question.
Absolutely, I think a lot of the e-learning that I think a lot of us mentioned, I think is not, I mean, some of the stuff maybe that you do at university is complementing existing face-to-face programs, but there's a lot of the massive open online courses that Graham mentioned. For me, the question, to be quite honest, on the in terms of democratizing access to education is a question of access to some learning and nothing at all for a vast number of people who will never be reached otherwise. So I think a lot of learning which is being made available through sort of our platform, through a number of other global platforms, is a complete replacement for more traditional forms of learning. But I think that the challenge is, I think the mindset which I was trying to get to was that e-learning somehow is inferior, or it is seen as self-guided only, that the students are engaging maybe with some level of community participation, but actually looking at learning where you are really using the web tools to really have face-to-face discussions, being able to learn with students not just on this campus here in Beirut, but also engage with students in Johannesburg, in Nairobi, in New Delhi at the same time. So I think there the technology can really break some incredible barriers down and go way beyond what current models can do. And so I think rather than looking at it as a complement or even inferior in some cases, looking at the possibilities in some ways.
Yeah, I think I showed you some data showing that with all the studies, there doesn't seem to be at all any inferiority. But your second question is actually important in terms of the incorporation of these courses into the credit system and the graduation requirements and so forth, and how. And are they recognized as being, and that here there's a big lag, not only in this, but in many other areas between what universities and the classical structures of education and the technology that's happening with e-learning, so that, or the changes that are happening. And I think there's going to be a dialectic there, and people are going to have to catch up. But for the time being, you're right, there is a tension there in terms of, do we accredit this course? Can you get a degree based only on e-learning, etc.?
In online education, there are different formats. There is a format which is cohort-based, and it's not self-paced. It's not MOOCs. It's a regular class. The same curriculum that is used in classes, it's used online. It is built by the instructor, by the help of the instructor themselves, who are delivering the face-to-face courses. These kind of courses are the most close to the traditional face-to-face education, and it takes also the same timing. So if the course is 3 credits, let's say 40 contact hours, 45 contact hours. So the online courses will take the same, and it will be scheduled similar to the face-to-face courses, where all the students will come online at the same time, and the instructor will have some engagement with them. There will be teamwork and so on. So yes, there is a direction toward bringing the traditional education and online education to be more close to each other. But I think this will take time. Thank you, everybody. I don't think we have enough time. And I want you all to thank our panelists for their valuable informations, and I hope we did deliver what you need. Thank you.